thyroid gland is hormone secreting gland of the neck. It produces the hormone thyroxine T4 and T3, which primarily required for the maintenance of metabolic rate, development in the child, and protein synthesis in the body. The hormone acts on several parts of the body such as heart, gastrointestinal system, nervous system, and it regulates menstrual cycles. That is the reason it influences the fertility of a female. Now, what are the disorders related to thyroid? Number one, hypothyroid, where there is underfunctioning of thyroid gland. Hyperthyroid, that is overfunctioning of thyroid gland. Goiters, congenital hypothyroidism that affects children, and rarely the cancers of thyroid gland.
Goiter is enlarged thyroid gland. It is a swelling in front of the neck which moves up and down on swallowing. It is 4 times more common in females than in males, and it is more common in the younger age group. A patient usually presents with a swelling in front of the neck, or it may be an incidental finding on imaging. In case of large goiter, the patient may come with compressive symptoms because of the compression of the vital windpipe, food pipe, or nerves, resulting in difficulty in swallowing, difficulty in breathing, coughing, hoarseness of voice. Or the patient presents with florid symptoms of hypothyroidism or hyperthyroidism. Surgical modality is used whenever there is compressive symptoms and there is a suspicion of any cancer or confirmed cancer.
Thyroid diseases are classified as hypothyroidism and hyperthyroidism. Now, hypothyroidism is a condition where the thyroid does not produce enough of thyroxine. Now, in this situation, the balance of chemical reactions in the body gets affected. Now, there are various causes for hypothyroidism. Some of the most important causes are, the first one being autoimmune, which is called Hashimoto's thyroiditis. Secondly, the treatment of hyperthyroidism. Thirdly, radiation therapy. Fourth, following any surgery which involves the head and neck. And lastly, certain medications. The next most important disease of the thyroid is the hyperthyroidism. Hyperthyroidism is where thyroxine is produced more or in excess by the thyroid gland. The most important cause for hyperthyroidism is Graves' disease. Graves' disease is again autoimmune, wherein the body's immune system produces antibodies which stimulate the thyroid gland to produce more thyroxine. The next most important cause for hyperthyroidism is toxic adenomas or toxic multinodular goiter. Here, these toxic adenomas, they are non-cancerous benign lumps which are found in the thyroid gland, and they are walled off from the rest of the thyroid tissue, and they start producing excess of thyroxine. So how can we treat hypothyroidism and its symptoms? It's extremely simple. By supplementing thyroxine in the form of tablets. Also avoid eating large amounts of cabbage, cauliflower, or broccoli. Similarly, the treatment of hyperthyroidism involves a prescription of antithyroid drugs. So this summarizes the treatment of hypothyroidism and hyperthyroidism medically.
Usually, the ultrasound will detect whether the right lobe or the left lobe is enlarged, whether there are multiple nodules, whether the gland is having any solid or a cystic change, whether there are lymph nodes around in the neck. If any of these features are detected in the scanning, then we go ahead for the next test, what is called as the fine needle aspiration cytology, wherein with the help of our radiologist, an ultrasound guided needle test is performed. The name of the surgery is called as thyroidectomy, and here we can remove either one side of the lobe along with the isthmus, which we call as hemithyroidectomy, or we remove both the lobes and the isthmus, called as the total thyroidectomy.
The main indication of surgery in thyroid disease is, one thing is carcinoma and another one is toxic nodular goiter. And after once the FNAC shows that it's a carcinoma or suspicious of carcinoma, we have to subject the patient for the surgery. One take-home message for the patient is there is nothing to get afraid about the cancer because thyroid cancer is totally curable once it is diagnosed in an early stage.
We at Universal Hospital have a fully equipped team of surgeons, anesthetists, intensivists and radiologists.
Physician, endocrinologist and pathologist,
So together as a team, we will take care of the patient
so that we can give you a complete care in one setup.
and they will be in safe hands.